So welcome to our Active Knox speaker series. This event is featuring Dr. Jean Fitzhugh and Dr. Cristina Barroso from the University of Tennessee. I'm glad you're able to join us virtually today. This is our first shot at doing this virtually, and I hope it goes smoothly. So thank you very much. My name is Ellen Zaviska, and I serve on the staff of Knoxville, Knox County Planning and the Knoxville Regional TPO. And I work on coordinating the speaker series. So again, I'm very glad all of you are with us. I'm gonna real quick take down my slides so Jean can pop his up. I'll mention that our event and our speaker series are sponsored by Active Knox, which is a partnership that includes AARP, Bike Walk Knoxville, the Knoxville Chamber, the Legacy Parks Foundation, East Tennessee Quality Growth, Knox County Schools, and the University of Tennessee, and also the Knoxville Area Association of Realtors. Special thanks to the Tennessee Department of Health, which provides funding for this series. Active Knox is a group that's committed to sharing innovative and proven ideas that can help make Knoxville, Knox County, and our region more active, engaged, and an economically vibrant place to work, live, and play. This is the 13th event we've done in this speaker series. And we are actively planning one for later this year with a focus on racial equity and transportation. So we'll have more details on that soon, but I'll ask you to, if that sounds interesting to you, mark your calendars for the evening of December 3rd, and we'll get out more information on that soon. And if you ever have suggestions of speakers you'd like to hear from, topics you'd like to learn about, please just reach out and let us know, because we wanna make this a series that works for all of you. So while our speakers are presenting, if you happen to have questions, please drop those into the question and answer box. We'll keep an eye on that, and we'll address those after Jean and Cristina have spoken. Close that slide. And I'll send a follow-up email after this as well with information about the AICP credits and other learning credits that are available for this event. And now I'll introduce our speakers. So I've got a couple things in the chat, just making sure. Okay. Dr. Jean Fitzhugh will be speaking first. Jean is an associate professor in the Department of Kinesiology, Recreation, and Sports Studies at the University of Tennessee, Knoxville. So as I understand that department, Jean probably spends most of his time playing hacky sack. Is that right? Sport, recreation. His research focuses on how the built environment promotes or hinders transportation and leisure time physical activity within communities. That's a little more serious. And then he'll be followed by Dr. Cristina Barroso. Cristina is a health disparities researcher at UTK who partners with community organizations, health departments, and policymakers to provide a more equitable physical and social environment. Important work too. Cristina has written more than 40 peer-reviewed articles on childhood obesity, healthy eating, active living, body image, and e-cigarette use. So that's my intro. Jean, please take it away.
All right. I hope everyone can see my screen. Ellen, are we okay?
Yep, I'm seeing it. Thank you.
As we begin, I want to acknowledge the support that Cristina and I had from the Knox County Health Department and the Tennessee Department of Health and Project Diabetes. The support they provided was instrumental in allowing us to embed ourselves for 9 months into the City of Knoxville Park System. The support of the Parks and Recreation from the City of Knoxville was instrumental. There were so many people that opened doors and made it easier for us to go in and address what we were tasked with doing. And that's basically finding out how parks in the City of Knoxville contribute to physical activity and its burden of disease and the possible inequities that may be across the city. Now we'll focus on two kind of narrow points of our larger work, and that's the design and features and amenities and aesthetics of parks, and how they relate to how people interacted with their park. And then we'll look at and talk about the perceptions that residents have on their neighborhood park in terms of access and resources. So those are the two main tasks that we'll have today. There's a lot more that we have that we kind of left to the side as we moved preparing for our talk. It all started with Liliana Bourbono and the Knox County Health Department recognizing that the burden of disease wasn't equal across the city. Here you see a heat map of obesity by census tracts for city of Knoxville. And you'll note that in East Knoxville, we saw the prevalence rates being the highest. In terms of diabetes, the same basic burden came to light. And then by physical inactivity, the same burden, or at least the same at-risk population. So that Knox County Health Department was wondering, what about the resources people have in terms of being physically active? Is it equal across our city? And does it contribute to the burden of disease that we're seeing highlighted in certain parts of the city? So with that in mind, using support from the Tennessee Department of Health, Cristina and I, again, embedded ourselves for 9 months. We knew, and the Knox County Health Department knew, that parks are really a great way for people to improve their health. There are 3 ways. Physically, you can go to a park, you can walk, you can run in certain instances, certain parks. You can play tennis, basketball, softball. You can go to a park to just enjoy nature. You can engage with friends and family and community members to socialize. So even active visits to a park and passive visits have great importance to our health. Now, we were tasked with looking at adult behavior, as well as how it related to physical health. So we have a little focus on the physical side of the world, and we'll talk about passive versus active visits. The city of Knoxville has 94 parks, 11 community centers, and it takes in over 2,200 acres. It's a very complex park. It uses topography. It's very diverse across the city. It's a very well-maintained system. I have to say, I've been to every park. They're clean. There's very minimal disruption and social disorder. I was just pleasantly pleased to see the condition of our park. So kudos to the City of Knoxville Park System for maintaining it. Our system, to give you a little history, began to be developed in the 40s here in Knoxville. And for the most part, most of our parks, not all of them, because we've had some new parks being developed by Legacy Parks and others, the neighborhood parks in the city area were finished by the 90s or 2000. And they had 3 main tasks for passive park use: to make them attractive for kids, and then to allow people to have competitive athletic sports, hosting events, and allowing people just to engage in those types of activities. Now, almost all of our parks were developed before the Surgeon General's report from 1996, which is our first report actually saying definitively, the evidence is so strong that moderate and vigorous intensity physical activity can reduce your risk for a variety of different diseases. Since 1996, we've had 2 different versions of guidelines for physical activity. But keep in mind, as you hear some of our findings, that the parks were developed before we knew the great importance of physical activity. Our final result, a report, was given to the Knox County Health Department and the Tennessee Department of Health later, or the end of 2019. We spent 9 months in the field, several months planning. We had 27 major findings, 6 major conclusions, and 36 specific recommendations. Now, we're only going to hit on a few of those, again, related to park design and then park equity. So keep in mind, if you really want to see the report, which we're continuing to do other types of analysis for, you can find it at healthyknox.org. Basically, we looked at this. Who's using the parks in the city of Knoxville? When they go to a park and they're physically active, what types of activities? And among those activities, which ones or how much can be considered active in nature or health enhancing? And then what park features and amenities attract the most people? And finally, and this was really what brought the Knox County Health Department working with them, is equity. How equitable are the parks in terms of accessibility, the features, the amenities, and aesthetics? Are they equal across the different components of the city? We adopted a variety of different methods. The environmental audit, which I'll highlight today, park quality design scores for both physical activity, aesthetics, and features. We spent 2 weeks, different times of the year, at 12 parks, 4 days each week, morning, lunch, evening, to directly watch people in their engagement with the park. We used telephone and Facebook survey methods to talk to 800 residents in terms of their perceptions of the parks. And then we used street intersection data from those 800 residents to look at accessibility using geocoding and mapping. And Cristina took the lead in our key informant and focus group qualitative methods, which we'll highlight in the equity section. All right, switching to who's using the parks. Through direct observation, we saw almost 4,000 people across those weeks and days and hours. Basically, the adults and seniors, if we compare it to a national study of park use, we had a higher proportion here in Knoxville. And we had a higher proportion of minorities using the parks in Knoxville compared to the census tracts surrounding the different parks. This is very informative for us and will be a part of some of the things we shared later on in terms of academic journals. Here's something I really want to hit home. When we went to the parks, looking and observing, in many cases, 6 out of the 10 areas were empty. They had no park users. And if you look here, Malcolm Martin Park, which is one of the best parks in the city, 85% of all the activity zones were not being utilized. Conversely, if you look at Fountain City in the bottom of this graph, 7 out of 10 of the activity zones had at least one user across the different areas of the park. So what I just flashed on this slide, number 6, number 41, and number 16, those are the park design scores. Malcolm Martin is number 6 of the 94 parks in terms of park design. And it had the highest level of underutilized areas. Fountain City, on the other hand, number 16, which is a really good score, by the way, again, had a lot of people using the park. And what we concluded, that park design and the features and amenities and aesthetics don't guarantee people are going to use the park. So we see a lot of parks empty. And when we saw people, the number one activity was sedentary in nature. People were sitting, lying down, or just standing, typically near a pavilion. The number 2 activity, walking. 3 out of 10 adults were seen moving and walking throughout the park. Now, here's where we have a misalignment of park use and the interest in the types of leisure time physical activity. Among the 800 residents of the city, 66% of them said their number one leisure time physical activity was walking. That most adults, and this is not unusual, this is very typical across the United States, walking is the number one leisure time physical activity. And among those residents, only 4% of them reported an activity that would utilize an athletic court or field. Now, this will come back up in our recommendations for what we can do to increase park use and physical activity. Specific to park design, we have different features that are usually active or passive or can be used different ways. Playgrounds, open spaces that allow people to do whatever they want to do and gives them a source of creativity. Pavilions, athletic courts and fields, walking trails, swimming pools, and skate parks. Again, they can be active or passive depending on how a person's utilizing that particular feature. Here's Malcolm Martin Park. It was number 6 in the design, and you can sort of get a layout of the really nice little walking trail that's got a playground and a shelter and many benches across the walking trail, basketball, a baseball, softball field, parking lot, restrooms. Of course, this is one of our parks that has a pool near it, but it's a very complex park that has a variety of different features. Here's another really good example, Sam Duff. This is one of my favorite parks because it's got a variety of different shelters and playgrounds. It's got the old track from a high school that was located nearby. It's configured to where with a multi-purpose field that could be softball, soccer, shelters, restrooms, and basketball. It's a park you could go to and accommodate a variety of different activities. Now, taking those park features and visiting 94 parks, here's the prevalence of those features across our city of Knoxville. No surprise, open space is number 1. Playgrounds, walking trails will come back. We'll talk about those, 42%. But their athletic courts and athletic fields are pretty prevalent too.
Jean, we have a question from Laura Smith. She has her hand up. I don't know if she wants to type it in or in the chat so that we can answer it.
Probably be best to do a chat to make sure we can get through this, and then we'll take the questions at the end. Aesthetics, we scored on it, that and amenities, again, to get our park design score. Here are a snapshot of our top 20 parks. Victor Ashe, number 1 for physical activity, and our own IAMS Nature Center scored the highest for aesthetics and amenities, which is really no surprise. The walking areas that we have are very conducive to physical activity, but they're really didn't contribute a great deal to the overall score. So you see a big difference between IAMS and Victor Ashe. We'll come back and hit on a few of these parks, but the overall score is right here. And again, we're going to go back in and revisit some of these parks and rescore them because there have been renovations that have occurred. And I know many of these scores are going to change. Our scores by the different types of parks, community parks, which are our larger parks. And then on the very bottom, we have neighborhood parks. Without doubt, the larger the park, the community parks had the greatest score, highest score across all metrics. Now the neighborhood parks here on the right for all of these, typically were half the score that you see for the community parks. There just aren't as many features, which there's not enough room to integrate those features in. The aesthetics were in half, and the amenities were in half. Neighborhood parks, which is really what we're kind of really focusing on, just didn't have as much attraction for adults as the community parks, which really shouldn't be a surprise to anybody. Neighborhood parks, when we looked at the overall scores and features, they're very child-centric. They're not geared towards adult physical activity. They're very limited activity opportunities. And when we looked at the different feature and being empty, which I alluded to earlier, athletic fields and courts just weren't being utilized. Spring, fall, of course, we weren't there in the summer, so that could be a little difference there. But the number one, or the place that had the most occupancy, was the pavilions, regardless if they were around open spaces or athletic fields. So park design, I'll go back to this, doesn't guarantee people are going to visit the park. Now here's my health enhancing physical activity. There's two things I want to share with you right here. If you look at the bars, these reflect the number of users across all of our observation periods. And playgrounds had about 1,200 people of the 4,000. The largest number of users were in playgrounds, and that included both kids and adults. Athletic fields had the fewest number of users. Athletic courts, predominantly basketball, some tennis, was much more than the athletic field. Open spaces, and again, pavilions had a lot of different use. Now the red line is the intensity of the physical activity noted in those particular areas. So anything within this red area meant it's moderate or vigorous physical activity. Anything below means that the intensity is more sedentary and light. Pavilions and open space had more passive physical activity, less likely to engage in any moderate level walking. They were sitting, standing, or lying. Athletic fields and courts, moderate and vigorous. They were there, they were active, and again, that's really no surprise, but now that we can quantify that. I have to turn to the design aspect related to active transportation. I know with Active Knox, we're concerned about promoting active transportation to places, destinations. The Centers for Disease Control is really interested in promoting destinations to parks. 45% of the parks had sidewalks with at least one boundary, and those parks had much higher scores. So parks with sidewalks near them had many more features integrated into and amenities and aesthetics than those that didn't have. Greenway linkage was really a great factor in terms of use. If a greenway went near or intersected with a park, we saw the higher overall park design score in all metrics. The greenways had greater use users going to that park, using the park, and again, there were more things to do there. Now that could be related to the whole notion of larger parks being more connected to greenways. So this is where we want to get into equity, and I do want to do one thing related to park design and equity. We really wanted to know this. I know the Knox County Health Department was really interested in this. Equity exists in our park system. The number of parks, the size, the features, the amenities, and all metrics. There was no difference in west, south, northwest, northeast, or downtown. Now, there were some differences related to active transportation. There is park inequity related to sidewalks and greenways. So the south is the one area that has the fewest sidewalks going or near a park. And related to greenways, the northwest has the fewest parks linked to greenways. However, there are a large number of sidewalks near those particular parks. So I think we have to look at the broader scheme of things right there. Inequities related to active transportation and access. No inequity. I mean, everything was equitable in terms of the park design and layouts. However, now this is where Cristina is going to get into talking about misalignment between perception and reality of residents. So Cristina, I'll turn this over to you right now.
So what we did to have a better understanding of what parks meant to the community, we conducted focus groups and key informant interviews with community leaders, individuals such as principals, pastors, home association, presidents, and things of that sort. And then just focus groups were with various community members within that census tract. Now, this schematic here shows how beliefs, attitudes, knowledge of what's happening in their community influences their perceptions of what the park quality looks like. So I'm going to start in the upper left-hand quadrant with park location and equity. And these perceptions then run into the perceptions of neighborhood parks in despair, which then run into the perceptions of park equipment, amenities, and features. But there are also perceptions of unity within the community, pride of what the community brings and does for individuals. And that's community unity. So let's first start with park location and equity. These are some quotes from both a key informant and a couple participants in an area of by Western Avenue, where people told me that there was no park in their very readily available neighborhood. As you can see, the first one tells us that there is no park, and that individuals in their community actually use playgrounds from a local church or other community resources. And the participants tell us that, quite frankly, there isn't anything. And so they're telling us that from their perception, they see that they do not have a park in their neighborhood. This then also translates into or goes into the despair of some individuals reported back to me that said that they thought that their parks were not well taken care of, or that they weren't to the standard of what other neighborhood parks look like. The first quote tells me that the equipment and things at the park were really not up to par with other parks, and that individual lived close enough to the park, but it wasn't worth their while to go to the park. They also told me that their parks, the equipment or the amenities and features were boarded up and weren't able to use for the kids. And that it's boarded up because there's a hole in there. And they also saw that a lot of people who would go to the parks actually vandalize their parks. And so that kids shouldn't be there playing because they could see things that were inappropriate, that were drawn on picnic tables or in their equipment areas, or that they saw other things on the ground that could harm children. And so they really perceived and believed that their parks weren't up to par with other parks in other neighborhoods. And they then also really, another big thing that really brought up to what they found or what they reported back regarding the inequity that they perceived was that the park equipments, the amenities, and the features weren't available to them. For example, they mentioned that there were no bathrooms or water fountains, and that they didn't have similar type of park features like a splash pad and other things in their parks compared to other parks in other neighborhoods. And I'll tell you in a minute what other parks and other neighborhoods they're referring to. And one person also told me that they thought that the parks were really geared toward children, which Jean mentioned at the beginning, that that's how parks were designed, but there really aren't anything for older adults to engage in to be physically active. And older adults really want to be active, but there's really nothing that would allow them to be active at the parks. And so the last quote really tells us about how they wish there were other things for older adults, especially those who are probably 75 and older, to really be able to engage in some type of physical activity. Now, I keep telling you that the participants told me that they compared their parks to other parks in other neighborhoods. And those other parks in other neighborhoods really referred to West Knoxville. And this, I think, is a quote that really embodies that feeling, that sense of inequity. Not all parks are created equal. The further west you go, the better the parks. And I didn't include a lot of other quotes, but what people were telling me was that it wasn't just their parks that they saw that weren't equal. They were talking also about their communities in general. They were mentioning that other neighborhoods, specifically those in the west area, have more of everything, except for, of course, fast food and those types of restaurants. But they said they had more healthcare providers in their neighborhoods, that they had their schools were in better shape. So I think what was happening, and they were telling me, was that they see inequity not just in their parks, but also in their community overall. And that perhaps that perspective really made them feel like they weren't being brought to the table or heard. But what they also told me as they talked about their neighborhood parks and what's available to them was that they were very proud of their community. Now, Jean here has a couple pictures that correspond to some of the things that have been highlighted throughout the city of Knoxville, of renovations and things that have really been talked about, like at Lakeshore and what happened recently at Fort Kidd. But there are also renovations happening in the East Side community that I think that also need some advertising and announcing and promoting that community pride and that unity in those areas, so that people can actually be attracted to those areas and participate and go there as well. Because I think what the community members were telling us is not that just that there's an equity from their perception, but also there's more advertisement, there's more draw, there's more discussion of other areas than what's available to their communities. And they believe that their communities really have a lot to offer and things that can be done and can help people be even more proud of being a Knoxvillian. Jean, I don't know if you want to add something before I go on.
No, let's go ahead and move on to.
One of the several things of what community members told me were that they hold church events and services throughout the summer and the spring. So when it's still nice and there's fellowship, and that really brings in different individuals from the community, not just there in their local community, but also members from throughout, that really help to unite and really bring fellowship. They also mentioned that in the summer, there's the Kumba Festival, which brings pride to the African-American and Black community, and all different types of activities. And they talked about how that used to be such a big draw to their community, but it has gone less and less announced in the media, less and less announced in other places, and it's overlooked, and people don't know about what that's there. They also talked to me about how schools would do events at those local parks and would allow kids and families to really use and engage and do different things. And then one of the things that I think is really important, and I think unfortunately many Knoxvillians are completely unaware of, is the Heritage Square there for Alex Haley at Morningside Park. That is a huge tribute to him with a statue that embodies his love of writing and the love of reading and of helping children to have that draw as well. And the quote here tells us that that's been around for years and years, but people don't know about it. People don't remember it. And I agree when I'm talking with my students who are 25 and younger, are completely unaware that we have that here in our community. And that's something that they believe that should really be brought out and talked about, the various things that these parks in the east side of Knoxville really bring to the community and bring to the city, and could be a draw to other members, as well as another thing that people would want to come to see Knoxville for.
Cool. Let's switch over to recommendations. Using the science for physical activity in parks. We know, and this is based upon all of the national studies, and this is where we spent about a month of our time sort of looking for literature. Park facilities, park design, and is not sufficient enough to attract people to parks. And when they come, it's not sufficient enough to make them active. There are 4 things that are essential. Park programming, hopefully supervised. For adults, for each new program offered at a park, it increases park use, and this is nationally, by 48%. Signage and programming, promoting or marketing that programming, also has been shown to dramatically increase park use. Now I'm going to talk a little bit more about how that kind of ties in with Knoxville. Park accessibility and safety. Remember this notion that very few parks had sidewalks? Well, even fewer had crosswalks near those intersections near the parks. And last, increasing the number of facilities. The most important feature related to park use and physical activity is building in walking loops to the parks. Walking loops meet those 66% of Knoxvillian resident who would like to walk for their leisure time physical activity, and it may make the park an attractive destination to walk from their home, or if they get in their car to go become physically active at a park. Now this is nationally. If I had to consult with any park system, these would be the 4 things I'd be looking for. Now, specific to Knoxville, we're recommending that when the open space allows it, to integrate new physical activity zones with the walking loop emphasis. Now, I know walking loops are being integrated into several areas in town, but this should be a major focus. And the underutilized athletic fields, there were many of them that I think had the opportunity to create and redesign into a new activity zone. So using input from citizens and the interest of what they'd like to do, perhaps we can redesign existing features within the park. Park signage and maps, they're there in certain parks, but I think we can improve or at least increase the park signage for features within the park as well as things outside of the park. For instance, you can create walking loops in the neighborhood streets and have that walking loop on a signage of the park, showing how residents can better interact with their park and their neighborhood streets. I would install 3 essential features: water fountains, restrooms, and emergency call cylinders. One thing that we didn't report on today was the perceptions and barriers of park use. The number one barrier for not going to a park is perceived safety. I know these may be, I don't know what is involved in the design of emergency call centers, but they give that perception of safety and being able to reach out if needed. Porta potties, many of our parks use porta potties, and let me tell you, every one of them, when I peeked my head in there during the audit, they were clean. It was lovely. I think if we had porta potties at all of our parks, it would make it more attractive for people to take their children. They'd feel more secure in going there. Linkage of parks with greenways. Now, our Greenway Coalition, our Bike Walk Knoxville, all of the things we talk about in terms of increasing active transportation, greenways really matter here. And I think as we design our greenway plans, to consider linking them to parks. Crosswalks. Again, I saw very few crosswalks in the adjacent intersections. I think with those, it will give the perceptions of safety and allow people to feel more comfortable going to their parks. And then many of our parks, many of our really good parks, don't have public transportation or transit access. If there was a way that we can ensure that parks had that public transit, cat routes would be lovely. But for right now, there are some parks that aren't accessible via public transit. These are all sort of taking the park design recommendations. Now, when it comes to perceived equity of parks and what Cristina was talking about, there are 3 recommendations there. Cristina, I'll turn this over to you again very quickly.
So based on what the discussions that I had with the key informants and the focus groups participants, one of the big things that really, what they told me was that we really need to invite neighborhood community members to engage and do some of the work that we're doing so that they can help take the lead as well as provide feedback on what we're doing and understanding and seeing. So one of the big things would be to invite residents to help conduct some of the park environment and safety audits so that they can see how it's done in a rigorous manner that's standardized, and so they can have a perspective of what it means to have equitable parks and from an objective measure. The other thing would be to really try to use programming that would help build into that existing community pride. There are groups already doing a lot of things at parks. So let's think about maybe helping them adopt parks or adopt different things that will help them become more involved in the community, as well as advertising that's happening so that people can see. There are numerous organizations that do that. And then to really try to get park activation, we really need to have those shared experiences and have those connections that individuals can talk about and show that people are actually being engaged at parks.
Okay, as we close, and we are closing here to go to the Q&A, when we finished our report in 2019, December, basically, since then, there have been a lot of things that we need to recognize that sort of reflect our recommendations. For example, Danny Mayfield Park. It's open space with a playground. It's got sidewalks adjoining it. It's next to a school, but there was really nothing for adults. With the help of the Knox County Health Department and Tennessee Department of Health Project Diabetes, there's an adult fitness zone that really, I think it's going to be well received from the community. That just was grand opening with our mayor last month. At Cal Johnson Community Center and Park, which was another park that scored fairly well. But even now, here's the new basketball courts that had funding from different organizations, their park, their playground, everything about that whole park has been renovated and redesigned. And this is one of the parks we're going to go back and rescore. I know the features, the amenities and the aesthetics have been improved dramatically through this renovation. And here, this is most recently, I think all of us probably have seen this, Morningside Park, which is one of the gems of the park system, in my opinion. Here's a map of all the features that are currently there. There's the Haley Heritage Square area that Cristina referred to with the playground. There's a great walking trail. There's a disc golf shelters. There's open space. It's just a really nice park. It's got a little issue. Topography is always a little barrier for certain types of people. With Blue Cross Blue Shield through their Healthy Place initiative, it's really taking it and adopting many of the recommendations, things. The fields are going to be multi-purpose. Pavilions, a challenge course, fitness station, a walking trail that's going to be enhanced. It's going to be more attractive for adults. So things are happening in East Knoxville. Hopefully perceptions of the residents in that area will equal out to what's really on the ground, because there is park equity. And despite what we heard in looking at every park, they're well maintained, they're clean. I did not see a lot of social disorder, so perceptions are misaligned with actual boots on the ground. Saying that, with the time we have remaining, Cristina and I will take questions. Thank you for your lunch period. I'm going to end the slideshow right now.
Thank you so much, Jane and Cristina. That was fantastic. That was a lot of information. This is Ellen here back at Knoxville, Knox County Planning. And we do have some questions that popped up in the Q&A and in the chat, and I'll start with one of those. Deb asked a question about partnerships that could help promote activities within the park. She mentioned some groups like the YW, the YMCA, Big Brothers Big Sisters, neighborhood groups, the university. What do you think about those ideas of community partners working with local governments to promote park usage?
We definitely love that idea. We actually recommended having that community building, that community mobilization to get them engaged in order for them to provide input on what's the best thing for them to do. Some partners already are doing things like what Deb mentioned of the YMCA and the YWCA, as well as the Boys and Girls Club and things of that sort. So it is important to really engage those leaders. And that's one of the recommendations that we did have in the overall report that we talked a little bit about here, but not fully, of having them be involved so that they too can provide some feedback and decide what's best for the communities.
Great, thank you. And we've got another question. Sorry, did I cut you off there, Cristina?
No.
Okay. Thank you. So we've got another question here from Scott. With the situation right now, the pandemic, will that affect future park designs to take into account what we've learned in terms of social distancing, water fountains? Will that affect the design of amenities like that or make them less or more desirable? What do you guys think about that?
I'll leave it to the experts at the city of Knoxville Parks and Rec to kind of really go there. Just from my observations, I know we had our playgrounds closed for a while. I have seen, and I know everyone here has an opinion, I've seen a lot more use of the parks than we saw when we were doing our direct observation. And people have utilized the parks much more than they did pre-COVID pandemic.
I also think that there could be designers for water fountains that could make it so that people can still socially distance or not put their mouths on certain things, that they could use water fountains. So I think that's something that people are already thinking about, how to better design things so that if a pandemic ever hits us again in the future, we're better prepared for that. So I think that too is a thing. But even though we don't have a vaccine yet for COVID-19, I imagine that with time we will, and that we will be able to go back to activities in the parks and other areas on a much more regular basis where people can congregate.
Yeah, I'm sure people are working on that idea of how to, how do you have a water fountain or, a drinking fountain that's, maybe you have just an ornamental fountain that shoots hand sanitizer up in the air. We can all grab it and use it to clean up. So we got another question here from Sandra. What role do community gardens have in park design? How does that impact usage? Do you guys have any sense of that?
I think they're a great location to be able to integrate community gardens in the neighborhood parks. And that's a way to engage neighborhood associations and residents near that park. I think it's a lovely idea. It may already be going on. I didn't see any per se in our parks when I was out there. Again, it may be that the city of Knoxville's Parks and Rec Department has some greater insight into that. That's a lovely idea. I like the idea of neighborhood associations adopting a park. There may already be neighborhood associations doing that, but the more we can engage the local residents to the neighborhood park, the more likely we're going to see that use in that physical activity with that.
Very good. Well, we had another question that popped up in the chat about the impact of, I think this is speaking to children and their use of parks, the impact of online gaming and digital technology, and that is something that the children are spending their time doing. What do you guys think about the impact of that on the use of parks by children?
Many of the focus group participants and key informants did mention to me that they believe that kids aren't using parks because they're always online. We did not interview any children. That would be one of the next steps that I actually would like to do, to see what the perceptions are from kids, given that we've looked at adults. But I don't think we saw anything other than those kinds of comments from participants.
Now, I note a lot of our playgrounds in the parks have some very creative, mind-opening features. I went in, as I went to every play set, I looked at all the different components and how they interacted with each other. So even though I haven't really done the analysis yet, playgrounds in terms of the quality and the features are going to vary across playground, but there are some really creative playgrounds in the city. I don't have children. I can't really, I'm sort of lost.
Very good, thanks. So we got another couple questions rolling in. Keep the questions coming in the Q&A box, folks. We've got 7 more minutes before we'll wind down. Joan asks, what are your recommendations for someone thinking about installing outdoor exercise equipment in a park or another outdoor space? Do you have any specific ideas about what they should or shouldn't do?
You know, you can design your fitness stations or your outdoor fitness areas. For example, Morningside Park's in a really unique fitness area. The Danny Mayfield Park, I know there was a lot of input from various people in terms of what types of equipment would be appropriate. If it were me, I would install the adult fitness areas next to playgrounds. Why? Because that's where most adults are going, as we're seeing with the kids. I think allowing an opportunity, not just for a bench for the parent or guardian just to sit and watch their child, to actually think about doing a family-related activity where the child can play, the mom and dad or grandparents can do balance activities. I kind of put those two together if it were me.
Okay, I like that recommendation, Jean. And I say that as someone who goes to the park a lot with my daughter. And, you know, my job is just to stand there while she swings.
It never fails whenever we went. And again, we saw a large portion of adults
Yeah.
at the playgrounds. They were just passive. And they were
There watching your kid play. We've got another question. I like this one. What do you, how does this work translate to rural communities, if any way?
I'm actually working with a rural community, Hardeman County, in a CDC project, and their parks are in, it's a very distressed county. One of the important destinations for people to be able to exercise and be active are their parks, and they have parks. They're very large parks. They've got athletic courts and fields. They're in disrepair. Based upon some of the things we brought in from Knoxville, they're now looking at enhancing their parks and redesigning and taking away, for example, softball fields that haven't been used for years and making walking trails. So they're actually repurposing their parks because 50 years ago in Hardeman County, as I've been told, softball was the game of games. And there are softball fields everywhere, but very few people are doing that as far as adults now. So they're looking at the walking trails and other ways for aerobic activity. So rural areas are seeing, I think, or can take some of this away in terms of enhancing parks. Low cost ways. Excuse me.
Great, thank you so much, Jane. I think we've got time for one more, and this is one that I thought of as I was reviewing the report prior to this session. You know, the report talked about, you know, the people who are generally inactive had a greater perception of their neighborhood and their park as being less walkable and less accessible than people who are generally active. And I was just wondering if you had any thoughts of which do you think came first? Do you think it's that people are less inclined to be active and so they don't perceive their neighborhood or their park as promoting activity, or is it the other way around? Christina, you were the community engagement. Do you have any thoughts on that?
I would say that it's actually something that's happening concurrently. As we saw our neighborhoods being designed so that their car use is happening, so there's less opportunities for engaging within your own community of walking. We then started seeing parks being built further away from communities and neighborhoods. Something that some of the participants told me in the focus groups was that when they were growing up, maybe not necessarily in Knoxville, they remember there was a library, a school, and a park all within walking distance from their home. And today, if we look at our neighborhoods, is you have to drive or take that bus to get to the park, drive and take the bus to get to the school, drive or take a bus to get to the library, and all of different locations. So I don't really think it's a chicken or an egg situation. I think it's happening concurrently because there are policies in place outside of the parks and rec environment that are really influencing why we aren't engaging in the healthy behavior, which should be our default behavior. There are other things that are impacting how our cities are being designed and how things are happening that then makes it feel like, oh, the chicken or the egg situation, but it's really another outside system or policy that's really impacting what's happening with our parks and our neighborhoods and the ability for us to be active when we're at those parks.
Can I make one closing comment?
Please do.
Our park quality scores, the instrument we used was validated and created in the San Diego park system. And it's one of the probably the best instrument out in the field right now. Our park system scored equal to the park system in San Diego. And we're probably, I think, the second metropolitan park system to undergo this type of scoring procedure. So to say, I was really happy to see the scores across the systems compared to San Diego. We have really good parks. We have some parks that are well maintained, but very little use. And it's equal across the different planning sectors here. But we've got a nice park. It's just we can do things, I think, to increase people coming to the parks and having more active visitors.
I think that was a great way to close it out from both of you. You know, Jean driving home that it's not so much about the parks, it's a lot about the perception and getting people into them, and Cristina making the point that it's more than just it's the neighborhood, it's the design of where our homes are and our schools and how our streets function, and that's what we're always talking about here with Active Knox, is how do we get people more active in our parks and our neighborhoods and all sorts of places. So I want to thank everyone who came and joined us for this, and the great questions and the great back and forth we had in the Q&A and in the chat. And I especially want to thank our speakers, Dr. Fitzhugh, Dr. Barroso, thank you so much.